Hey guys, it's Smiles behind Lupus, and I'm coming with you with another educational video that I said I was going to do on um, insurance and how to better get a better plan and understand what certain terminologies mean. First, I'll apologize. I'm recording from my laptop. I'm trying to see if that works a little bit better than my phone, but let's get started. So, as you guys know, if you have Medicare, it is now open enrollment, which is from October the 15th to December the 7th. And that gives you the time to see if you want to switch to a different plan. They do it every year at the same time, every year. So, some of the terms that you may see when you are choosing an insurance, um, let's start off with number one as deductible. When you see that, you're like, what is my deductible? Um, Deductible is a specific amount that you have to pay out of pocket before your insurance will start to pay anything. Some people have $100 deductible, some have 1,000, some have more. So you have to reach that dollar amount. Um, so every time you go to the doctor, it will go toward that deductible. And once you've met that, then your insurance will start to pay, whether it's 100% at that point or 80% or whatever. Number two, co-insurance kind of goes hand in hand with deductible. Once you meet your deductible, your co-insurance sometimes it'll kick in, and that's where you pay a portion of the payment made against the claim. So let's say they said, okay, you have $100 deductible, you've met that, but once you've met that, you have a 30% co-insurance or 20% co-insurance. So that means the amount that the doctor is billing for that claim, you have to now pay 20% of that. And a lot of insurances are set up that way. So some are 80-20, some are 70-30, where they'll pay 70, you pay 30, or they pay 80, you pay 20, whatever the case may be, depending on their insurance. So that's what that means. The next thing is co-pays. Copay is a fixed amount that you pay each time you go to a doctor's appointment or a hospital, just depending on your plan. Some insurances make you pay every time you have a doctor's visit, every time you go to the ER, every time you have a lab, every time you have an x-ray. So those things add up. But co-pays normally don't go towards your deductibles. That's just a set amount that they want you to pay. So a lot of times you won't pay your copay until your deductible is met. So you're either going to have a copay or you're going to have a co-insurance, one of the two. My little notes here. So you have HMO and PPO, and some people are like, well, what is that? HMO is health organization where only you can only go to certain doctors that they tell you to go to, and it's normally a limited number of doctors that take HMO insurances because it's a pain. You have to have an authorization to go to the doctor, to a hospital, to get a test done. It's very time consuming and it's very frustrating because the doctors really don't get paid a whole lot for taking HMO. And their negotiated rate is a whole lot less than a PPO plan. So, PPO, which is a preferred provider organization, I feel they've always offered better and a larger variety of places that you can go, because a lot of times when you have an HMO, you're limited to your city. You have to get special permission to go to a whole different state, and 9 times out of 10, a different state won't even touch your insurance. So if you have PPO, 9 times out of 10, you can go anywhere in the United States and be seen by a PPO doctor, and you don't have to have an authorization. So if your doctor says, hey, your family doctor says you need to go see the lung doctor, they will just send your referral over to them saying that you need to be treated for XYZ, and that's it. They don't have to call the insurance company to make sure that this doctor's on the list and all of that jazz. So PPO is the better way to go. Next, we're going to talk about Medicare. Medicare is a federal health insurance for people 65 and older or ones with disability that get SSDI, which remember I've done a video on SSDI and SSI. Um, I will link that in the description box below so you can go back and look at the disability process and what those two mean. So if you're awarded SSDI, meaning you've worked long enough and you've paid enough into the system, so you're getting, actual disability, you have to wait 2 years for your Medicare to kick in. In the interim, some people are eligible to have Medicaid until their Medicare kicks in. If you have SSI, meaning you didn't pay enough into the system, or you're a child, or whatever the case may be, you're automatically given Medicaid. You can't get Medicare until you're 65. So there are different parts of Medicare. Sorry, my husband sent me a message. Okay, so Medicare has several parts. Part A is hospital coverage, inpatient, nursing homes, anything to that effect. Part B, Medicare, is your doctor's offices, outpatient procedures. So sometimes they'll ask, do you have Medicare Part A and B? Because there are cases where somebody may only have A or some may only have B, just depending on the situation. You have Part C, which is a Medicare Advantage HMO plan. So, with that being said, since this open enrollment for Medicare, what happens, a lot of people don't understand it, and a lot of them are elderly, and the insurance companies get over on them, and it really frustrates me because what they're trying to do is they'll tell them, because you pay for your Medicare every year or every month, it's I think 130 or 140. I have to look at my invoice because it comes straight out of my check. They pay that, you pay that every month. So when it's time for open enrollment, they get you by saying, oh, well, you don't have to pay monthly payments. You don't have any deductibles, no copays. So a person on a fixed income, they look at that as like, oh, that's a blessing. And it may be for your case, but they're putting you on an HMO, and it's only a limited amount of providers that will take your insurance. You have to have an authorization to do anything. And when I say anything, anything, you have to have authorization to go to the bathroom. I'm just being real. It is horrible for most people. I know I can speak for myself in this area. The HMO that's big in this area, I'm not going to name names, but it starts with an H. And there really literally are any doctors that take it. So my advice to you, not saying don't switch to, everybody's financial situation is different. Sometimes you have to do what you have to do. But if you're going to switch to a Medicare Advantage plan Part C, make sure you research the plan. Call your doctors personally to say, do you accept this insurance? Because pretty much they'll assign you a provider. Even you can't just go to who you've been seeing. 9 times out of 10, your doctor will not take that plan. So you have to go to a whole new doctor that doesn't know you. And what I've found is you can't even trust the Medicare website, or the companies that try to offer to say that these companies take the insurance, because that is not true. Um, what I found, their website is not current, and I've been stuck where I've had, not with the Medicare Advantage, but with an HMO, thinking that a doctor took it, and it's on the website to say they take it, and then I get stuck with this huge bill because they really are not in network, and you're just screwed, and you're stuck with thousands and thousands of dollars as a medical bill. So just be on the lookout when people are trying to get you to switch over to an HMO. It sounds good, but sometimes your meds aren't covered under that because they pretty much combine everything into one thing. So I don't, Medicare, you can go anywhere in the United States. You don't need an authorization. Yes, I may be stuck with a 20%, bill, but I'd rather do that than to can't go to certain hospitals because it's gotten so bad that a lot of hospitals won't even take it. It will be considered out of network. So, um, yeah. So just really, really pay attention and trying to make sure I have not skipped over anything. Trying to go over my notes. Oh, Medicare also has a Part D. So I have a Part A, B, and D. D is your prescription plan. Um, and what I also have on my prescription plan, I signed a patient assistance form because I don't have a secondary. So I qualified for them to pay part of my premium, and my meds can't cost more than a certain amount as long as I'm getting what's on my preferred, prescription plan. So that was a blessing. So I told anyone, if you have Medicare and you don't have a secondary that covers like your meds at 100%, then you need to definitely, look into the JORT program, try to get patient assistance through them, and they will handle it. So right now, I'm in the process of having to switch to a different one that better needs for my medications. But the current one, I have no issues with. It's just they are saying that my pharmacy will not be in network with them in 2018, which that means I just have to go find somewhere else because they want me to go to Walmart, CVS, or Walgreens. If you use them, fine. I don't like them. Here in my area, they've caused too many issues, and I don't want to be doing them. I like the mom and pop where they actually know you. You don't have to wait for an hour to get your prescription. So I'm calling Medicare and trying to work with them to try to find me a new insurance that I can stay where I'm at. So sometimes you hear Medicare patients say that they're in the donut hole when it comes to their prescription plan. And that means that Medicare has a guideline where they set a certain dollar amount that your meds can't go over per year. And if you reach that amount, you're responsible out of pocket for paying for it. So that normally happens around this time of the year, around October-ish, 1st of November. Patients have reached their max. Some people reach it way beforehand, but a lot of them reach around this time frame where they've reached the maximum and they, have to find other sources or, have to actually pay out of pocket, which that can be very expensive if you're on a whole lot of different medications. All right, the next thing is Medicaid. Medicaid is a health insurance that is assist low income families and funded by the federal government and on the state level. Normally, when you get SSI, like I said earlier, you are awarded Medicaid. But I tried to get Medicaid as a secondary, but my household income was too much. Go figure. And they wouldn't allow me. So now I just have I have Medicare and no secondary. So I'm stuck with 20% of everything that I go. And when I'm going for my Benlysta alone, it's well over $10,000 a month, if not more. My fluids, I think it's like 1,000, and I was having to go twice a week. So you add that up, that gets expensive really, really quick. So with Medicaid programs, there's a thing called share of cost, and they'll give you based on your income, your monthly income, they'll set a specific amount that you have to pay before Medicaid will kick in. So a lot of people that still work but still fall in that category that Medicaid can help them. Sometimes they say, okay, you have to reach $300 for a family of 4 each month before we'll kick in, which that's, okay if everybody's going to the doctor. But everybody doesn't go every time. So look at the person that has to go to the ER or has to get all these tests because one visit, they have to pay that $300 before Medicaid will pay anything. They have one that's also called medically needy. Let's say you exceed the amount of the household income, They will also look at your monthly income and say, you know, we will pay for, let's say you had cancer, they say, well, we'll pay for everything with chemo related, but you've got to meet this amount before we'll pay you. So that's what that means. I can't stress this enough. Um, if you don't have any health insurance, which that happens, it happened to me. And I used to always say, I've always had insurance ever since I've been on the earth, yada, yada. Never in a million years I thought that I wouldn't have had insurance and have lost and couldn't work and all of that. It happens, especially when you're dealing with chronic illness and autoimmune disease. It happens. Um, so if you find yourself in that position where you can't pay for your medications, know that every drug company has to offer a patient's assistance program. You ask the doctor for it, or you can go on their website, you download the form, fill it out, give it to your doctor, let them fill out their portion, and send it in. And most people are approved, I say within a week or two, depending on the company, but they will either give you your meds for free, some will ship them straight from the company, or they will give you a copay assistance card if you have um, insurance that your copay for your prescriptions are extremely high. You can use the copay card, or they'll give you stuff for free. I know me with my Benlista, when I was not working and I didn't, this is before I got married, and I was just out there. I couldn't get any insurance, didn't know what to do. Benlista, I was able to get their copay assistance. And pretty much the card that they give you, they will pay anything, that's Benlista related. Not, they don't pay for the facility or the supplies that go along with it, but they will pay for the medication itself, which that's a big chunk. So I was blessed to have that. And let your doctor know, like, hey, I don't have insurance. And you can go to Walmart, have a $4 plan. You can get 90-day supplies on a lot of stuff. You can go to Publix. I'm just naming places around in my area. Publix has free antibiotics, certain free blood pressure pills. So sometimes your doctor may have to make some adjustments in order for you to afford what you have to, because I know I was on 20 plus medications and I literally had to wean myself off of them because I did not have the money to pay for them. Like I was just at that point, I didn't have it to fork out $500+ a month to take this medication. So those are options, as well as doing a free clinic. Most areas, no matter where you stay, have a free clinic. Take advantage of those. Whether it's through the health department or through a church, just try to stay somewhere that you're getting care, because let's say you're trying to get disability, they're looking at you keeping those appointments on a consistent basis, even though we know it costs a whole lot of money. But if you can find a free clinic or somewhere that works on a sliding scale, it's better than nothing. And they look at that, because otherwise it'll ding against you, and they'll say, well, you didn't go to a doctor in a whole year. And you're thinking, well, I can't afford to go to a doctor. But they don't care. They don't see it that way. So those are some good tips. So guys, that will be it. And try to keep it short and sweet. So I hope you guys enjoyed it and you learned something. And trust, if you have any questions, you can email me. And my email is smilesbehindlupus@hotmail.com. I will have that in the description box also below. So I hope you guys have an awesome rest of your day. And I hope I taught you something. But like I said, hit me up in the comments below or email me if you have any questions or concerns, and I will try to answer them. The reason I did this video is because when I did patient care for 15 years in the medical field, I also did medical billing. I started doing medical billing, I think I was like 15. My mom's friend had her own billing company, and she brought me in to do data entry, and that's how I started. And then of course, once I got my degree, and there was times where I would do billing on the sides and just make extra money to help doctors' offices. So that's why I'm coming to tell you that. All right, guys, be blessed.